Hare Krishna. This is Yogaraj from Bhaktivedanta Hospital and Research Institute. Welcome one and all for the today's podcast, which is on the sugar and pressure talk. That is, the talk on diabetes and hypertension. Bhaktivedanta Hospital and Research Institute is a 300-bedded multi-speciality tertiary care NABH accredited hospital which is located in Mumbai, Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. This podcast is under our flagship program titled ISKCON Devotees Healthcare Services, which was launched in the year 2023 at Mayapur. Till date, through this initiative, we are fortunate to have got the opportunity to serve more than 5,000 devotees globally. This enlightening session is streamed on Hare Krishna YouTube channel. We are honored to welcome Dr. Suraj Purushotthaman, His Grace Shyamlal Das, our esteemed consultant, internal medicine and chief intensivist, with over 18 plus years of experience, and he will be sharing the insights and make us understand how the lifestyle diseases like diabetes and hypertension can be prevented and managed effectively. So let's begin our live talk show. Hare Krishna Prabhuji.
Hare Krishna.
So, starting with the context of the today's health talk, Dr. Suresh, first of all, thank you so much for joining us and removing the valuable time for us and giving the insights on the today's health talk. So, can you begin by sharing what diabetes and hypertension actually are in simple terms?
So, diabetes and hypertension both are lifestyle diseases.
Right.
So, when we say lifestyle diseases, it means diseases that can be modified, treated,
Mm-hmm.
and altered by the way we live. So, diabetes essentially is high blood sugar,
Mm-hmm.
which can happen because of either decreasing insulin or because the body becomes resistant
Mm-hmm.
to the effect of insulin.
Okay.
High blood pressure or hypertension is when the normal blood pressure, which is essential for all of us to live,
Mm-hmm.
when the normal blood pressure starts rising beyond a certain level,
Right.
then it is called hypertension or
Okay.
high blood pressure.
Okay. Okay. So, normally you might be having seen in the OPDs as well. So, why do these two conditions often go hand in hand?
Very good question. So, as I said, both are lifestyle diseases.
Right.
So, when the lifestyle is incorrect,
Mm-hmm.
so the metabolism of the body gets altered, and that alteration in metabolism leads to both these conditions.
Okay.
We call it the metabolic syndrome.
Mm-hmm.
That means, uh, I mean, if you look even say 50 years back,
Mm-hmm.
there was hardly there were hardly any patients who were suffering from such high blood pressure or complications of blood pressure,
Right.
because people had good lifestyles. They would
Absolutely.
sleep on time, get up on time. So, as the urbanization has taken place, as rural setups are getting modified,
Mm-hmm.
we are seeing more and more of these lifestyle diseases. And that is why obesity, diabetes, hypertension, sleeplessness, all of
Mm-hmm.
these come together.
Correct. Right. And from your experience, what trends are you seeing in the rise of these conditions in India?
When I was a student in JJ, we used to see patients with diabetes at the age of 45, 50, 55,
Okay.
and people with blood pressure would start off around the same age, 45 to 55.
Mm-hmm.
What we are seeing now is uh, patients coming in with complications of blood pressure and diabetes, like an acute heart attack
Oh.
at the age of 25, 30, 35.
Mm-hmm.
So, mm, although scary, but the trend is the younger generation is getting affected.
Correct. Right.
And uh, what we would normally see at the age of 45, 55, we
Mm-hmm.
are now seeing at 30, 35, sometimes even 25. And that is what is really scary. And uh, and that's what should be our message to the general masses, in that we have to correct our lifestyles,
Actually, the sedentary lifestyle.
sedentary lifestyles.
Correct. Right. So now let's talk about some causes and its risk factors. So what are the major lifestyle factors that lead to diabetes and hypertension?
Um, when we say uh, when we say about speak about diabetes,
Hmm.
uh, it is most of the times it is what we eat and how much we work.
Correct.
So our grandfathers, our great grandfathers,
Mm.
uh, we would always see them working in the fields, right? They were active. They were even at even at an age of 75, 80. I'll give the example of my grandfather.
Mm.
When I was 17, I went to meet my grandfather in Kerala, and he was 84 years old. And he had asked me that uh, we have coconut trees, and you have to put manure for those coconut trees. So he asked me to dig a hole around the coconut tree so that the
Mm.
manure can be put.
Yeah.
So he kept observing me. I tried digging it with the spade, 15, 20 minutes.
Mm.
I'm trying digging. I'm 17. He's 83. And after 15, 20 minutes, he comes, he walks in, he takes the spade, one shot into the soil,
Mm.
and the whole thing parts away.
Oh.
And I'm amazed. He's 83
Oh.
years old,
Hmm.
but look at his strength, and I'm 17, and I just can't do anything.
Right.
So this drastic shift, you know, it's a drastic shift. We are seeing that our youngsters, what are they doing? I mean, even during our young age, we used to play, we used to uh, do so much of outdoor activities. What do you see our children doing these days? How many outdoor activities are there? So this trend we need to correct.
Mm.
That let's if not activities like working in the fields, at least go out and play. So
True.
that at least that ways you are keeping your body active, and if your body is active, you will not develop these conditions.
Right.
And second most important factor is what we're eating.
Mm.
And our I mean uh, even 3 decades back, food was what was cooked at home.
Right.
Now food is cooked anywhere, wherever you say food is cooked,
Yeah.
whether it is the vada pav dhaba, or it is the pizza pasta stall, or uh, whatever. It's all high oil, high cholesterol food, fast
Mm.
food,
Mm.
and this fast food is only increasing our tummy fat and not adding to our muscle.
Right.
And that's where diabetes, blood pressure, obesity, everything is setting in.
True. Absolutely. And nowadays, though, the food thing is on the application itself. You just
Yes,
click on the app and the food
yes,
is there at your
yes,
doorstep.
yes, yes,
So, sir, can emotional stress and anxiety directly impact the blood sugar and pressure levels?
yes. Very true, very true. And this is what we are seeing in our ICUs. We had, I'll give you a case study. A young gentleman, just 32 years old.
Mm-hmm.
He was working as uh, an assistant manager in a company. He was promoted from assistant manager to, I don't know, some senior manager or whatever. And that doubled his work. And because he wanted to maintain that, he kept working. His hours of sleep started decreasing,
Mm-hmm.
and that increased stress within 6 months brought him to the ICU with an acute heart attack.
Oh.
So, stress directly plays an important role. The amount of hours you sleep, the quality time you spend, the me time.
Mm-hmm.
With the rise of urbanization, with the way the corporate world is going, especially in cities like Mumbai, we see that there's hardly any me time. People don't have time even to talk to their own family members.
Correct.
Where is the de-stressing?
Mm-hmm.
You're working, just working your lungs out. Where are we? Where are we heading to?
Mm-hmm. True. Absolutely. So, let's talk about the organs and the complications which have been affected. So, how does uncontrolled diabetes affect our kidneys?
So, firstly, we should understand what diabetes does to the body.
Hmm.
increased sugars is not just the sugar, it is the alteration in metabolism. That means how that increased sugar is going to increase the cholesterol level, the triglyceride level, the bad fat in the body,
Mm-hmm.
the toxins in the body. So, sugar per se, when needed, it works like a nutrient. When not needed, it acts like an inflammatory toxin, a slow inflammatory toxin.
Okay.
हम बोलते हैं ना दीमक लग गया है.
Hmm.
दीमक दिखता नहीं है. You can't see the termite in the wood.
Correct.
It's only when the termite gnaws into the entire furniture
Hmm.
that it crumbles down like powder. That's
Hmm.
what diabetes does to every part of the body, not just the kidney, not just the heart, but every part of the body.
Hmm.
What it does is, because of this low grade inflammation, every tissue starts shrinking
Mm-hmm.
or gets inflamed.
Hmm.
So, same thing happens with the kidney, same thing happens in the heart, with the eyes, with the brain. And so, with that low grade inflammation, the kidney function slowly dwindles.
Mm-hmm.
And unfortunately, people do not realize that your kidney function is going down till it crosses a certain, uh, you know, a certain level,
Mm-hmm.
when the creatinine starts going up. But by that time, already 75% of the kidney function is down, because creatinine rises only after 75% of the net
Okay.
kidney function, the EGFR drops.
Mm-hmm.
So that's where people do not realize how diabetes is
Diabetes.
damaging.
Right. True, sir. So, and what does the high blood pressure do the damage to the heart?
So high blood pressure, uh, like diabetes only, it also causes, because as the blood pressure rises, the flow of blood to each organ
Mm-hmm.
is compromised. So that compromise in blood flow leads to tissue damage.
Okay.
So for the heart especially, when the blood pressure rises, the heart has to pump blood against a higher resistance.
Correct.
Like, you have a pump which has to push, like, you have our water pumps.
Mm-hmm.
So you have a water pump which is supposed to pump water right to the third floor. Suddenly you want that water pump to pump water to the seventh floor. At some point of time, it's going to fail.
Mm-hmm.
That's what happens to the heart.
Correct.
So the heart is pumping against higher resistance, higher resistance. At some point, the heart is going to fail.
Hmm.
And that's what we try to explain to our patients in the OPDs. Sir, मुझे तो कोई तकलीफ नहीं, बीपी की गोली क्यों खाऊं?
Hmm.
That it's not कि तकलीफ नहीं है, वो तकलीफ आने से पहले आप अपना सही
Ilaj.
करो,
Correct.
इलाज कर लो.
Right. True.
That's important, and that's what people need to understand, that we don't treat the condition when there is a complication.
Mm-hmm.
You treat the condition to prevent complications.
Right. True. True. So, requesting our viewers to check on the screen that we have displayed the banner of ISKCON Devotee Healthcare Services, wherein you can find the information, wherein you can get in touch with us for all your medical needs. Also, you can check on the ticker at the bottom of your screen, mentioning all the details of the connects, wherein you can connect on that numbers and you can directly get in touch with us for the sessions for your congregation. So, we'll take the first question what the viewer has asked. Does eating too much of sugar directly cause diabetes?
Yeah. So eating too much of sugar uh, would not necessarily cause diabetes,
Mm-hmm.
provided you are expending that sugar. For
Okay.
example, you have a sports person
Hmm.
who is going to run a marathon. So even if he's taking that additional sugar, he's utilizing that additional sugar
Hmm.
in running the marathon. His muscles are going to use all that sugar. So it's not going to cause diabetes.
Okay.
Like, I gave the example of my grandfather.
Mm-hmm.
He was only a rice eater. He
Hmm.
would eat only rice, pure carbohydrates, we would say.
Hmm.
But what was all that carbohydrate doing to his body?
Hmm.
It was building his muscle, because he was working in the fields.
Right.
His muscles were strong.
Correct.
So, if you are eating that much sugar, you should be able to expend that much sugar.
Mm-hmm.
Otherwise, it is a problem.
Okay.
So that maintaining the balance is important.
Mhm.
And if you're not going to maintain it, then that added sugar is going to create problem. It is not just taking extra sugar; it's taking extra oil, extra fat, the loads of cheese that people have in their burgers, and what that
Pizza.
pizza. Yes.
Yes.
So uh, all of that,
Mhm.
all of that is going to cause diabetes.
Correct. Right. So, we are speaking on the organs part. So, can you explain how the conditions affect the eyes or even lead to blindness?
Right. This is something that uh, anybody and everybody should know that as I spoke about the kidney and the heart,
Hmm.
the same kind of damage, the low inflammation can happen to the retina. Now, the eye has many chambers,
Hmm.
the anterior chamber, the posterior chamber, and then the retina. So, retina is where the image flashes and then it goes through the optic nerve to the brain. So the eye is only the organ to focus the image. When we see it through the tissues in the brain. The
Mhm.
brain is what is perceiving the image. So the connect from the eye to the brain is the retina and the optic nerve. And this is where damage occurs
Okay.
in diabetes.
Mhm.
So the retina gets damaged. What we call as diabetic retinopathy, because the sugar, it starts sticking onto the retina,
Okay.
causing low grade inflammation, as I said.
Mhm.
And that low grade inflammation, because of poor flow of blood, that inflammation worsens, and then slowly, the retina gets damaged, further damaged. And if you do not correct the diabetes, do
Mhm.
not bring down the sugar under control, then gradually the retina gets practically
Practically
damaged and you are
damaged.
unable to see.
Okay. Okay. That leads to
That can
blindness.
lead to blindness. Of
Okay.
course, there are other causes of blindness also. There can be retinitis. That just raised sugars can increase the concentration of sugar in the lens, leading to a haziness of vision. But these are temporary problems. Plus, patients with diabetes and blood pressure may have vascular strokes
Correct.
affecting the brain, especially the area of the vision, the occipital center,
Mhm.
and that itself can lead to blindness.
Okay.
So, multiple causes, but diabetic retinopathy is something that is very common, occurs because of inflammation, because of raised sugars.
Right. So, are the brain and the nervous system also affected by the long-term diabetes or hypertension?
Yes, yes. Hypertension does not affect the nervous system as much as diabetes does.
Okay.
Diabetes, as I said, because it's a low grade inflammatory situation,
Mm.
that the less blood flow to the tissues,
Mhm.
especially the nerves,
Correct.
the long nerves that we have, the nerves of the leg, the nerves of the hands,
Mm.
they can get uh, gradually damaged, and the damage is slow.
Right.
So for many years, if the sugar is not controlled,
Mm.
people feel कुछ नहीं हो रहा है, मैं सब कुछ खाता हूँ, मुझे कुछ नहीं होता है, मैं एक्सरसाइज नहीं करता हूँ, मुझे कुछ नहीं होता है,
Mm.
क्यों फालतू में मुझे आप तकलीफ उठाने की बात कर रहे हैं. But by the time they start getting those symptoms of peripheral neuropathy,
Mm.
the damage is already done. दीमक ने वो पूरा
खा लिया.
खा लिया है. Then when you come to the doctor and then you expect डॉक्टर कुछ करो, मेरा पैर ठीक नहीं हो रहा है.
Mm.
But it's already too late.
Correct.
It's already too late.
Yeah. So we'll take the further questions from the viewers. Uh, what is the best type of diet for someone with diabetes or hypertension? Actually,
So,
this question I'm going to take at the end, but the viewer has asked, so
okay.
yeah.
So, the best diet. So, from the national health sources also, uh, we had celebrated the millet year,
Hmm.
right? Our Prime Minister also publicized this. Why millet year? Because millets are one thing that improves metabolism.
Okay.
So adding jawar, bajra, and cutting out the wheat and rice, it does a lot of good.
Mhm.
We've had patients who, just not able to control their sugar despite 3 4 medications. We gave them a simple diet. You just cut off your rice and wheat and shift over to millets.
Okay.
And within a month, we could see the sugars coming down. Within 4 months, an HbA1c of 10.6 had come down to 8.
Oh.
So you see the range, how a good diet, simply good diet. He was already exercising, he was trying this, trying that,
Mm-hmm.
not working. Just shift of diet, and his HbA1c from 10.6 came down to 8. And of course, in the next 6 months, that 8 HbA1c also came to 6.7.
Mm-hmm.
So he was, almost in the non-diabetic category.
Right,
So,
right.
good diet, of course, it's not just the diet.
Hmm.
You have to do your exercises, take your medicines on time. But yeah, millet-based diet, cut off on the oils, cut off on uh, uh, pure sugars.
Correct.
चाय में चीनी डालना है,
Hmm.
गुड़ डालना है. मेरी वेरी कॉमन क्वेश्चन, गुड़ डाल सकते हैं क्या डॉक्टर साहब? So
Yes.
not allowed, not allowed. So for those who cannot resist, you
Hmm.
can use sucralose,
Hmm.
natural, sugar free. That is safe. But
Okay.
otherwise, cut down on direct carbs and cut down on rice and wheat. And if you have a millet based diet, it does a lot of good.
Right.
Lot of
Correct.
good.
We'll take the other question from our viewer. If no one in my family has diabetes or blood pressure, can I still get it?
Uh, you can if you are too arrogant to your body. So, uh, yeah, chances are less.
Mm-hmm.
If our genes are good, chances are less. But it is a lifestyle disease.
Mm-hmm.
So if you say that, you know, मेरे फैमिली में माँ पिताजी किसी को
किसी को
नहीं
नहीं
है,
है.
तो मैं खाऊंगा पीऊंगा और एक्सरसाइज नहीं करूंगा, तो it is a matter of time
Hmm.
that metabolic syndrome will set in. You will start developing fatty liver. That fatty liver will progress, and then that's what happens.
Okay.
So uh, it's always best to have a good lifestyle. Always.
True.
Yeah. But yes, if you have nobody in the family has, uh, you have a better leverage to have burgers and pizzas.
Absolutely. So, sir, as we spoke about diabetic neuropathy, so we would like to understand first of all what is diabetic neuropathy and how does it impact a patient's daily life.
Yeah. So the initial symptoms of diabetic neuropathy would be tingling, numbness, a little burning in the feet, which may not always be disturbing.
Mm-hmm.
What happens is, as the neuropathy worsens, it is not only the nerves which get damaged, but also the vessels which are supplying the tissues of the leg that get affected.
Okay.
And over a period of time, because the nerves are weak, the person does not realize when he hurts his leg,
Mm-hmm.
because pain sensations get weak. And that's when small wounds start getting bigger and bigger. So you may see that, it's very common. डायबिटीज है, छोटा सा घाव था, बड़ा हो गया. ये
Right.
बड़ा कैसे हो गया? Because he didn't realize that he's hurt his leg.
Mm-hmm.
And because he's not realizing the pain, the wound grows, and it comes to a point when he starts seeing, oh, there is pus on my leg. And by the time he reaches the doctor, the uh, the wound is already so bad that it's getting gangrenous. He needs an amputation. So all these are features of peripheral
Diabetes.
vascular disease
Mm-hmm.
because of diabetes, plus the diabetic neuropathy.
Hmm.
So both these things. So it may start off with tingling, numbness, and few symptoms. Sometimes people have imbalance while walking.
Right.
So these are some of the symptoms. But what is really scary is it affects your pain sensation, your proprioception.
Hmm.
So that leads to wounds, and wounds that cannot be healed soon.
Correct. Right. We'll take the next question, sir. What is the alternate to sugar which we eat for sweetening milk and other food stuff?
Uh, you can take sucralose, which is
Sucralose.
generally considered safe.
Hmm.
Previously, sugar free was saccharine, but saccharine over a period of time was found to have toxicity to the kidneys, and so preferably it should be avoided.
Hmm.
Sucralose is safe, and There are other artificial sweeteners, but limit it to as much as possible.
Okay. Now let's talk about the symptoms and the early detection. So, what are the silent or the early warning signs of diabetes and hypertension?
So, diabetes generally in the initial phase will not have symptoms.
Okay.
And that's why it is so important that we keep checking.
Hmm.
We encourage people who come to our OPD that आप अपना डायबिटीज चेक कर लो. ओ डॉक्टर साहब मेरे फैमिली में तो किसी को है ही नहीं. So why do we insist that you get yourself checked?
Hmm.
In case it is on the border, you know where to correct yourself.
Hmm.
You don't have to land up with a complication before you know that you need treatment.
Correct.
So uh, previously we used to say after 45 get an annual checkup.
Hmm.
Nowadays we say after 35 please get an annual checkup. Because we are seeing everything worsening so fast.
Hmm.
32 years getting a heart attack, high blood pressure, high sugar. So getting a small blood test
Hmm.
would save you, a lot of other problems.
Right. True.
Prevention is better than cure.
Absolutely. That's a mantra of our life. Uh, we'll take one another question from Mr. Rajesh Talreja ji. Um, after even after dieting, weight is not reducing, but no diabetes. But my HbA1c is 5.7.
Great. So what is the problem?
So that's the question.
So if your HbA1c is controlled,
Yeah.
and uh, uh, you still want to lose weight,
Mhm.
the best way is exercise. Second is know from a dietitian that what diet you're following, the amount of calories, the amount of protein that you're taking, whether it is in the right quantity. And if all of that is still appropriate,
Mhm.
and you still think you're putting on weight, I mean, of course, we should look at the BMI. If the BMI is more than 35,
Mhm.
reaching 40,
Right.
then you really need to be concerned.
Mhm.
But if the BMI is not so high and HbA1c is controlled, your lipids are controlled, your cholesterol, triglyceride is controlled,
Mhm.
you don't have fatty liver, there's nothing to bother.
Okay. Okay. We'll take the next question from our viewer. What kind of lifestyle should one follow in their 20s to safeguard against such diseases?
Very good question. So the best thing to do is eat on time, exercise on time, and sleep on time. Three things. I keep telling all young people who come to my OPD
Mhm.
that just follow this: eat on time, exercise on time, and sleep on time. Eat the right food at the right time. Now, convincing our teenagers to eat the right food at the right time, I think, is probably the most difficult thing to achieve.
True.
Sometimes I feel it's easier to treat a patient on ventilator than convincing a teenager to eat the right food at the right time.
Right, right, sir. Right. So, let's talk about some prevention and lifestyle habits. What role does plant-based eating or sattvic food play in prevention?
So, again, if we go back in the past,
Yeah.
our grandfathers, great grandfathers,
Hmm.
there were no pizza pastas at that time. So, uh, what do we see? They lived uh, good lives, longer lives, healthy lives.
Hmm.
Most of them, most of them. So, uh, eating the right food at the right time, sleeping at the right time. This is also very important. Sleeping
True.
at the right time. What is good sleep?
Hmm.
When do we balance our NREM, REM sleep,
Hmm.
which is also so important for the body to heal well? So, the actual proportion of NREM, REM sleep
Hmm.
is best when you're sleeping between 9 p.m. to 12 midnight.
Okay.
It reduces to from 2 is to 1 it reduces to 1 is to 1 from 12 to 3.
Hmm.
And after 3, it reduces to 1 is to 1 and to half. And after 3 a.m., there's practically no ratios only. It's not going to, the balance between your NREM, REM sleep is not there.
Mhm.
So many of our patients who do night shifts, we've seen that 2 to 3 years of night shifts, and they're having migraine issues, they're having blood pressure issues, they're
Hmm.
getting obese, they are fatty livers from nothing, they're developing grade 2 fatty liver,
Mhm.
all kinds of metabolic symptoms. Why? Because your entire diurnal cycle has changed.
Correct.
So if you're in your 20s and you have the options, eat on time,
Hmm.
eat the right food on time, sleep on time, and take out time for exercise.
Correct. Right.
Some form of exercise. You
True.
decide what you want to do. You want to do swimming, you want to do running, cycling, play with your friends on a, I don't know, nowadays there are many cricket grounds also. But
Yes.
whatever.
Correct. Right. So, what is the standard medical treatment for diabetes and hypertension? If we talk about the line of treatment.
Line of treatment first is uh, try to balance your lifestyle first.
Mhm.
So it depends on what symptoms, what level of diabetes the patient is coming to me.
Mhm.
If it is an HbA1c of 7.5 to 8, not many symptoms, he's just done a regular checkup and he comes to me, I would give him a proper dietary advice. This is the kind of food you need to take. This is your calorie advice.
Mhm.
Try to cut down your night meals.
Correct.
At least in this part of Mumbai, most people are working in the at South Bombay. They return from their offices, reach here at 10:30,
Hmm.
then have their meal at 11:30 and go to bed at 12. So where is the night meal affecting? It's just causing more and more obesity, indigestion,
Right.
and worsening your metabolic syndrome. So if it is the initial phase, then diet and exercise. Once the HbA1c goes beyond that, sugars are 200, 250, 300,
Hmm.
then you need to start with medications.
Okay.
We start with basic metformin, maybe a combination of metformin with DPP4,
Hmm.
and see how things are working. But if somebody comes with a complication of diabetes right
Mhm.
at the onset,
Hmm.
comes with a bad infection in the leg, and a sugar of 500,
Hmm.
then you need to admit, treat the complication, give IV antibiotics or whatever, and start insulin.
Okay. Right. So, other question we take it from our viewer. What can be the possible reasons for elevated uric acid levels?
So, the commonest cause of elevated uric acid is uh, increased alcohol
Mhm.
or too much of red meat.
Okay.
These are two things which you really need to check. And if these two are ruled out, then there are certain metabolic factors, individual based, that leads to increased uric acid. Some people just cannot metabolize the uric acid.
Hmm.
So in those patients, we need to give them medications, and practically these medications go lifelong.
Okay. Okay. Potatoes are not good for diabetes. Can we take sweet potatoes?
No, both of them have the same carbohydrate content.
Right. Correct. Okay. So, when is the medication absolutely necessary for diabetes and hypertension? Once they're detected, or how it is?
That again, it is the level of diabetes at which you are.
Mhm.
Is it an is there are there no symptoms? If there are no symptoms, your HbA1c is between 7.5 and 8. A good diet, a regulated diet, a regulated lifestyle, good exercise,
Hmm.
walking. If not going to the gym, just walking half an hour to 45 minutes in the morning, walking half an hour to 45 minutes in the evening. Now everybody have those smart watches.
Right.
They tell you are walking 6,000 to 10,000 steps every
Hmm.
day,
Hmm.
so you know how much calories you're expending. So if you can just do that with good diet, a millet based diet, good exercise, I wouldn't give medicines in the
Right.
initial phase.
Hmm.
And if uh, after 2 months of proper diet and exercise, if the HbA1c is still not dropping, then Yes,
Okay,
medications.
right,
So
correct.
initially, it's always diet and exercise.
Mhm.
The emphasis is always on diet and exercise.
Right. So, how important is constant monitoring at home if any elderly person is suffering from diabetes or hypertension or pre-diabetic both?
So pre-diabetics, you don't have to monitor at home actually,
Mhm.
because pre-diabetic means if your HbA1c is something like 5.9, 6.2, 6.4, really does not require um, self-monitoring of blood glucose
Mhm.
at home.
Right.
But yes, if somebody comes with a complication like a diabetic neuropathy, or has had a bad infection, or has
Mhm.
had a bad urine infection, was in the hospital, required antibiotics, and is now healing, there you need to give a proper,
Monitoring.
proper monitoring. And now there are various ways of doing
Mhm.
sugar monitoring. The easiest way is, just check with an AGT stick at home,
Mhm.
maybe fasting or post lunch, and adjust your doses accordingly. Now there are also continuous glucose monitoring devices which are placed in your system, and you can reach at the target sugars, or the time in range is
Mhm.
recorded.
Mhm.
And that is another technique, especially for those who are labile diabetics,
Right.
where the sugar fluctuations are just too much.
Mhm.
Sometimes the sugar shoots to 300, taken a shot of insulin and it's dropping to 60.
Mhm.
So we've seen this happens with patients who have kidney dysfunction and liver dysfunction, or cardiac disease, and they're not able to take their meals properly.
Mhm.
There you need continuous monitoring.
Got it. Got it. We'll take one question from our viewers. Uh, Cause of diabetes is sugar or stress?
So raised sugar is the result of poor metabolism,
Hmm.
that the insulin in the body is not enough to uh, either manage the sugars, or your body is becoming resistant to the amount of insulin that is being generated by your body.
Hmm.
So the resistance to insulin can happen due to stress, can happen just because of obesity, can happen because of certain genetic factors.
Mhm.
So all of them can contribute.
Right.
The effect of all of that is raised sugars.
Hmm.
So the effect is raised sugars. The cause may be obesity, stress, emotional distress, so many things.
Right. Correct. So again, requesting our viewers to just check on the screen. We have displayed the banner of our ISKCON Devotee Healthcare Services, which is the flagship program of Bhaktivedanta Hospital and Research Institute. You can check on the contact numbers, which has a 24 by 7 helpline number, wherein you can get in touch with us and you can book an appointment on priority basis, and also to facilitate the emergency and other queries. Also, you can use our online chatbot services, that is Ask Bhakti, by visiting our website www.bhaktivedantahospital.com, and you can also chat with us on WhatsApp. The number has been displayed on the banner. So, we'll take one question from our viewer. Do the diabetes, blood pressure, hypertension are mainly due to overthinking, tension, or anxiety?
It is not the root cause, but it adds to the problem. So, especially high blood pressure can happen because of overthinking, stress, emotional disturbance. It
Hmm.
is known. As far as diabetes is concerned, diabetes can fluctuate
Hmm.
with emotional liability.
Okay.
We've had many cases where patients got admitted to the ICU with
Hmm.
uncontrolled sugars, and we did everything possible, but for 48 hours the sugar was still fluctuating.
Oh.
Then we dug into the history and found out that this lady was undergoing a divorce. And then we got our counselors, we got our psychiatrists, we got them to medicate her. And after counseling and medication from the
Hmm.
psychiatrist, within 24 hours, the sugars are normal.
Oh. Okay.
So it is a known fact, but it's not the root cause of everything.
Correct.
It
Correct.
can add to the trouble.
True.
Definitely add to the trouble.
Oh, absolutely. So, sir, what are some common myths and misconceptions people believe about diabetes and blood pressure?
Okay, so many. The commonest myth is that इंसुलिन शुरू किया और मेरे किडनी खराब हो गए. So I keep telling all my patients who come with very uncontrolled sugars that the reason why the sugar is uncontrolled is because the insulin in your body is not effective.
Mhm.
Either it has become too less or it's become resistant.
Okay.
So just adding insulin to your system will actually take care of all the problems, because the entire poor metabolic phenomena is happening because the insulin is not effective.
Okay.
So add the insulin,
Hmm.
आपके प्रॉब्लम सॉल्व हो जाते हैं. And the reason why diabetic nephropathy occurs is because the sugars are so high that it gradually destroys the kidney tissues. But patients come to the doctor at a time when the creatinine is already high or borderline high, and then the doctor says, okay, now you need to start insulin, and the patient infers that insulin shuru kiya or kidney kharab ho. Where the truth is that because insulin is on, your kidney function is preserved.
Hmm.
So this is a very common myth
Myth.
that इंसुलिन शुरू करने से किडनी खराब हो जाएंगी.
Mhm.
First, no. You start insulin, and if you are ready to take insulin, then that is the best treatment for diabetes. I have corporate patients who fly from Mumbai to London to US and fly back taking 3 shots of insulin, and they are very comfortable with it
Right.
because they know that we do not know when we'll have the next meal, कब ये खाना है, कब वो खाना है. तो इंसुलिन का पेन रखा, हम जानते हैं कि अभी ये खाना पड़ेगा, तो दो यूनिट 4 यूनिट ज्यादा ले लिए, sugar is always under control. So that is one myth that I keep telling all my patients, that insulin is the right treatment for you.
Okay.
Especially we see so many the rising trend of gestational diabetes in pregnant women, and that's an increasing trend because lifestyle is becoming so sedentary that uh, pregnancy is also, the age of pregnancy is also getting, from earlier it was 20 to 30, now it's from 30 to 40. We have ladies with 35 plus who are getting pregnant for the first time, and you see gestational diabetes. And how do you treat that? You have to give insulin.
Right.
That's the best way to treat it,
Right.
because maintaining the sugar during that time is so very crucial for the little fetus who's growing in the womb of the mother.
True.
So that is one myth that everybody should know, that insulin शुरू करने से कोई हानि नहीं है. It is only going to go do good to your body.
Absolutely.
And of course there are many others कि पैर पैर खराब हो रहे हैं, डायबिटीज से खराब हो रहा है कि आपकी दवाई से खराब हो रहा है. दवाई जब से शुरू किया तो पैरों में झुनझुन शुरू हो गई. अगेन तो दवाई शुरू करने से झुनझुन नहीं हो रही है, और डायबिटीज बढ़ने की वजह से झुनझुन हो रही है. The diabetic neuropathy is because of the uncontrolled sugar. It's not because of the diabetes tablets that you're taking.
Correct.
But patients generally infer it. Why? Because by the time their sugars are under control, the damage is so long that they feel that गोली शुरू किया और पैरों में झुनझुन शुरू हो गई. Again, that's another myth. Complications of diabetes are not because of the treatment that you're taking. It is because of diabetes per se.
Got it.
Then the commonest myth is कि दवाई लेने से मेरी किडनी खराब होगी. इतनी दवाई क्यों देने डॉक्टर साहब? एक दो दवाई दो ना. ज्यादा दवाई लेंगे तो किडनी खराब हो जाएगी. आप शुगर कंट्रोल करो तो किडनी बची रहेगी. That is another myth that people need to. It's not the tablets that destroy your kidney. It is the diabetes that is destroying your kidneys.
Right, sir. So, is it safe to stop the medications if all the levels are normal?
Okay, so first, uh, what is normal? That you should
Yes.
reckon
Correct.
with.
Yeah.
So control your HbA1c. That means your HbA1c is less than 6.4. Control your fasting and post lunch, And then how many medications are you taking
Hmm.
to achieve that control? Are you just on a single dose of metformin? Are you on a dose of metformin with DPP4? Are you on a triple drug combination
Mhm.
like a sulfonylurea, like glimepiride, Amaryl, or something like that with metformin and DPP4? So if the number of medications are more, it just means that the level of insulin or the level of insulin resistance in your body is much high. You stop the medicine and your sugars are going to shoot.
Yeah.
So stopping medicines in diabetes should be strictly under the guidance
Of
of your doctor.
physician. Correct.
If you do it haphazardly, then it's a good job done bad. You're asking for trouble.
True.
Ah,
True.
well, mujhe maar.
Yeah. So we have one question as you spoke about the pregnancy part. So we have one question from Ms. Purnima Shah. I have diabetes since 20 years during my second pregnancy. I am on diabetes medication daily. Is there any chances to treat in best way? Is it the insulin is good or to take the oral medicine?
So it depends on how well your sugars are controlled and how good is your liver and kidney function.
Mm-hmm.
So if your liver and kidney function is good, well maintained, your diet is good, then just continue oral medications.
Okay.
But if uh, uh, prolonged diabetes,
Mm.
if that prolonged diabetes is causing diabetic nephropathy, is causing fatty liver, or peripheral neuropathy, which is not controlled, well controlled, then insulin has to be taken. It all depends on how well your balance is maintained
Mm-hmm.
without end organ damage. When we say end organ damage, it means your eyes are protected,
Mm-hmm.
your heart is protected, your kidneys are protected, and your brain is protected.
Mm.
These end organs
Mm.
are well preserved. That means your diabetes is well protected. You don't need to change your diabetes medicines.
Mm-hmm.
If your end organs are getting affected, that is the time when you really need to think, yes, abhi insulin lena hi lena hai.
Okay. Right. We'll take the other question from our viewer. During morning only, the sugars are high.
Mhm.
It is the same continuation of this question of the pregnancy what we spoke. So during morning time, the sugar level is high. Is there any reason for it?
Depends on what medications you're taking.
Mm-hmm.
So, uh, again, morning sugars going high can be because of two reasons. One is, are your night medications correct? Is your night meal too heavy? Or sometimes your medications in the night are just too much, and your sugars are actually dropping in the morning
Mm.
at 3 a.m. or 4 a.m.
Mm.
And we call it the Somogi effect. And as a response to that dropping sugar,
Mm.
the blood sugar goes up when you wake up at say 7 or 8 o'clock. You test and your fasting sugars are high. It may be both these effects. So you really need to see your doctor to know whether it is the excess dose of medications, or it's a low dose of medication, or a heavy meal in the night which is causing the fasting to go up.
Correct, right. So, sir, when we speak about diabetes and hypertension, मुझे कुछ नहीं होगा because I'm young. But what about the elderly people also say कि हाँ आपका भी एज हो चुका है ना आपको डायबिटीज हाइपरटेंशन सब लगने वाला है. So what are the warning signs that a young people especially should watch out for the issue diabetes and
So,
hypertension?
first thing is, if you see suddenly your weight is coming down, that is definitely something that uh, people should note,
Hmm.
because uh, it could be just that your sugars are so high that you're losing sugars in your urine, and that causes weight loss.
Hmm.
So, uh, uh, unexplained weight loss
Okay.
is one definite warning sign. You should get your sugars tested.
Mhm.
Sudden you feeling giddiness, weakness when you're doing your jobs, or over say 2 to 3 months you feel that you're experiencing exhaustion, tiredness,
Hmm.
all these fatigue, these could all be warning signs. Again, diabetes per se has very, very little symptoms.
Okay.
The symptoms are because of the complications of diabetes.
Hmm.
So that is why knowing your system, and just a regular check will help you uh, prevent your body from landing into that stage of complications.
Correct. Correct. So now let's talk about some spiritual and holistic dimension part. How can spiritual practices such as mantra meditation or japa help in managing stress related blood pressure?
So, again, as I said, lifestyle. So, a regulated lifestyle,
Hmm.
right? So, a regulated lifestyle is what really helps.
Hmm.
So, uh, of course, mantra meditation, mana trayate iti mantra. So, the controlling the mind eh, from wavering into the wrong channels, right? Now, this mobile is such a dangerous thing. Before you know, you know, वो Instagram हो या कुछ भी हो, जो भी है, you do not realize how much time you have spent on it.
Consume. True.
So, uh, just trying to focus your mind,
Hmm.
that itself will de-stress. It helps channelizing your mind, de-stress your mind.
Hmm.
So that is definitely there. Uh, More than that, once you take up to devotional practices, we naturally disengage ourselves from unwanted things, time wasters.
Right.
So if you disengage from time wasters, you naturally use your time in doing your exercises, in eating the right kind of food, avoiding all those junk and high cholesterol stuff. And of course, uh, all those who have a regulated life
Hmm.
will definitely sleep on time, try to wake up on time, unless there are emergencies, of course. As doctors, we face emergencies, but
Right.
otherwise, if it's not emergencies, then just regulating your life,
Hmm.
that's what really improves you know your metabolism, the way you know so not just chanting, but disciplining your life.
Right.
And that's what our forefathers had. They
Hmm.
always had a disciplined life.
Hmm.
Wake up early in the morning at 4 o'clock, go to the fields at 6 o'clock, have your lunch at 12:30, come back, and then every evening was, you know, listening to Mahabharata Ramayana
Right.
before going to bed at 8:39.
Hmm.
9 o'clock, the lights were off. Everybody was going to bed. So, of course, I'm not saying that everybody should become like that. It's very difficult.
True.
But discipline,
Right.
discipline.
True. So, have you seen the improvements definitely in your OPDs and your patients who align this kind of lifestyle that is a spiritual discipline or maybe a balanced routine? So, are there any changes?
Definitely, definitely. I mean, the other case that I said,
Yes. Yeah.
uh, a lady getting admitted to the ICU with
Hmm.
uncontrolled sugars and giddiness and everything. And of course, that psychological counseling, our spiritual care department took over.
Right.
And of course, the patient needed medications for a few months, but then counseling.
Hmm.
And with counseling, you know, taking to mantra meditation, changing the routine of life,
Hmm.
and slowly things got better. It's a gradual process, it doesn't happen overnight.
Right.
Nothing happens overnight. You have to endeavor for that.
Hmm.
But that positive endeavor works wonders.
Absolutely.
Wonders.
We'll take one question from a viewer. Only eating dalia, khichdi, and upma for sugar patient. Is it the mandatory diet?
Oh, it's not like that. It's not.
Again,
Uh,
it's a myth.
it's a myth that इतना ही खाना है. नहीं नहीं, ऐसा नहीं है.
Hmm.
See, it is about how much you eat and how much you spend. as I told you about the marathon runner,
Yeah.
he's having sugar, but he's spending that sugar.
Mm-hmm.
So if you can, if you, even if you're eating, say आपने रोटी भी खाई, थोड़ा राइस भी खाया, लेकिन फिर आप वॉकिंग कर रहे हो, you are running, you are doing your jogging, you are doing your brisk walking, you are doing your 10,000 steps,
Mm-hmm.
you are sweating out, तो आपका HbA1c कंट्रोल रहेगा, because that extra calorie is being consumed.
Mm-hmm. Correct, right.
And of course there is intermittent fasting for those who find it too difficult. There's intermittent fasting, like uh, in Jainism they have, sunrise and sunset, eat between sunrise and sunset, and that's such a good system,
Mm-hmm.
because automatically there is 15 hours of no food,
Right.
and that itself brings down. Of course you can't just do intermittent fasting without consulting your doctor,
Mm-hmm.
but very good system. It's not only यही खाना है, इसके अलावा नहीं होगा, नहीं, आप क्या खा रहे हो और कितना एक्सरसाइज कर रहे हो,
Mm-hmm.
both are mandatory.
Yes, absolutely. So finally, Dr. Suraj, what message would you like to leave to our viewers, with especially those who are struggling to take the first step towards health?
I said, eat on time, eat
Sleep
the
on
right
time.
food on time,
Yeah.
do your exercises,
Mm-hmm.
and sleep well. And uh, of course it's difficult in today's age of artificial intelligence and
Hmm.
social media, and of course I'm not so good at all of this, but uh, I really see our teenagers, it's difficult even to counsel them that, look beta, ये आप जितना टाइम स्क्रीन टाइम कर रहे हो, ये आपके लिए अच्छा नहीं है,
जी,
it's not good for you.
correct.
But uh, I often tell the parents also कि आप अपना स्क्रीन टाइम कितना रखते हो, ये पहले बताओ.
Absolutely.
So the famous Gandhiji story, he
Hmm.
tells, आप, you must have heard that story.
Hmm.
Somebody comes to meet Gandhiji with his son and says, आप इसको बोलो कि मीठा नहीं खाना है.
Hmm.
And he says, okay, you come back after a
हाँ जी.
week and then I'll tell him.
Hmm.
So एक हफ्ते क्यों, कि पहले मैं तो
हाँ.
मीठा खाने से रुक जाऊं. So it's like that, you have to first uh, do those right lifestyle procedures
Hmm.
in your own life.
Right.
Apply those principles in your own life, and then we can tell our teenagers, our children, our kids, and
Absolutely. So, first of all, I would like to thank our viewers, those for your patient hearing with us from the starting of the session till this time. So, I thank our today's speaker, Dr. Suraj Purushotthaman, sir, to remove his valuable time and share the insights with us on how to take care preventive steps towards the diabetes and hypertension and to manage in this today's hectic life of ours. I also thank to our live streaming partners, Hare Krishna YouTube channel, and to again all our participants for joining for this today's podcast. Definitely we'll get back to you with the another exciting topic on this health in the next month with some other consultant from Bhaktivedanta Hospital. Till then, just take care of yourself and your family, eat right, sleep well, and take care of your health. Thank you so much. Hare Krishna.
Hare Krishna.